Which of the following techniques is most likely to minimize the risk of air embolism during cardiopulmonary bypass in non-cardiac surgeries? A. Use of an advanced filter in the bypass circuit. B. Regular anticoagulation therapy. C. Continuous monitoring of cerebral oxygenation. D. Use of pulsatile flow throughout the bypass procedure. Answer: A. Use of an advanced filter in the bypass circuit. Explanation: air embolism is a serious complication during cardiopulmonary bypass, and the use of advanced filters in the bypass circuit helps to remove air bubbles from the blood before it is returned to the patient. The presence of air bubbles in the circulation can cause blockages, leading to embolic events such as stroke or organ ischemia. In a patient undergoing cardiopulmonary bypass during non-cardiac surgery, what is the most critical reason for maintaining adequate perfusion pressure? A. To enhance the delivery of oxygen to tissues. B. To prevent the formation of blood clots in the circuit. C. To prevent hypotension during anesthesia. D. To maintain normal blood glucose levels. Answer: A. To enhance the delivery of oxygen to tissues. Explanation: adequate perfusion pressure is essential to ensure that oxygenated blood is effectively delivered to all tissues and organs during cardiopulmonary bypass. Perfusion pressure helps maintain blood flow to vital organs, such as the brain and kidneys, during surgery. Insufficient perfusion pressure can lead to ischemia and organ dysfunction. In a non-cardiac surgery involving cardiopulmonary bypass, which of the following factors most directly influences the success of weaning the patient from the bypass machine? A. Blood volume status. B. Surgical technique used. C. Anticoagulation management. D. Adequate ventilation and oxygenation. Answer: D. Adequate ventilation and oxygenation. Explanation: adequate ventilation and oxygenation are crucial when weaning a patient from cardiopulmonary bypass. As the patient transitions from bypass support to self-sustaining heart and lung function, maintaining appropriate oxygen and carbon dioxide levels is vital to ensure that the heart and lungs can resume normal function without compromising organ perfusion. What is the purpose of using a hemodynamic monitoring system during cardiopulmonary bypass in non-cardiac surgery? A. To evaluate the function of the bypass circuit. B. To adjust the flow rate of the bypass pump. C. To monitor the patient's body temperature. D. To track the patient's fluid balance. Answer: A. To evaluate the function of the bypass circuit. Explanation: hemodynamic monitoring systems are used during cardiopulmonary bypass to continuously assess the function of the bypass circuit. This includes monitoring the pump flow rates, pressure levels, and the adequacy of perfusion to the organs. These parameters help to detect potential issues with the circuit, such as pump failure or inadequate perfusion, and allow for timely intervention. Which of the following is the most common complication associated with cardiopulmonary bypass in non-cardiac surgery? A. Pneumothorax. B. Renal failure. C. Hemolysis. D. Hypoglycemia. Answer: B. Renal failure. Explanation: renal failure is one of the most common complications associated with cardiopulmonary bypass, especially in non-cardiac surgeries. Reduced renal perfusion during CPB can lead to acute kidney injury. This is more likely to occur in patients with pre-existing renal dysfunction, prolonged bypass duration, or inadequate perfusion pressure during the procedure. How does hypothermia during cardiopulmonary bypass in non-cardiac surgery help protect the patient? A. It reduces metabolic demands and decreases oxygen consumption. B. It minimizes the inflammatory response. C. It enhances the effectiveness of anticoagulation therapy. D. It prevents the formation of microclots in the bypass circuit. Answer: A. It reduces metabolic demands and decreases oxygen consumption. Explanation: hypothermia is used during cardiopulmonary bypass to reduce metabolic demands and oxygen consumption by the body. This helps protect vital organs, particularly the brain and heart, during the period when their normal function is interrupted by the bypass machine. Hypothermia can reduce the risk of ischemic injury and improve recovery post-surgery. Which of the following is the most important parameter to monitor when initiating cardiopulmonary bypass in non-cardiac surgery? A. Oxygen saturation of arterial blood. B. Blood pressure. C. Flow rate through the bypass circuit. D. Hemoglobin levels. Answer: C. Flow rate through the bypass circuit. Explanation: the flow rate through the bypass circuit is crucial to monitor during the initiation of cardiopulmonary bypass. It ensures that the patient is receiving adequate perfusion during bypass. Proper flow rates help maintain blood pressure, organ perfusion, and oxygenation, which are essential for a successful surgery. In a non-cardiac surgery involving cardiopulmonary bypass, why is the use of heparin important? A. To improve platelet function. B. To maintain a bloodless surgical field. C. To prevent clot formation in the bypass circuit. D. To stabilize blood pressure. Answer: C. To prevent clot formation in the bypass circuit. Explanation: heparin is used to prevent clot formation in the bypass circuit, which could block the flow of blood through the machine and potentially embolize to vital organs. By ensuring that the blood remains anticoagulated, heparin allows for smooth circulation through the bypass circuit, reducing the risk of complications related to clotting. What is the primary advantage of using a centrifugal pump in cardiopulmonary bypass during non-cardiac surgery? A. It is more efficient in delivering oxygen to tissues. B. It provides a more reliable backup in case of pump failure. C. It generates less turbulence and shear stress on the blood. D. It allows for better control of blood pressure during bypass. Answer: C. It generates less turbulence and shear stress on the blood. Explanation: centrifugal pumps are commonly used in cardiopulmonary bypass circuits due to their ability to generate smooth, non-turbulent blood flow. This reduces shear stress on the blood cells, which in turn decreases the risk of hemolysis and improves overall circuit efficiency. Centrifugal pumps also have a more constant flow, which is beneficial in ensuring steady perfusion during surgery. During non-cardiac surgery with cardiopulmonary bypass, what is the primary concern when cooling the patient to hypothermic levels? A. Reduced wound healing capacity. B. Increased risk of arrhythmias during rewarming. C. Decreased blood pressure during bypass. D. Inability to maintain adequate oxygenation. Answer: B. Increased risk of arrhythmias during rewarming. Explanation: hypothermia during cardiopulmonary bypass is often used to reduce metabolic demands and protect vital organs. However, a primary concern during the rewarming phase is the increased risk of arrhythmias. As the body temperature rises, the electrolyte imbalances and slowed conduction associated with hypothermia can trigger arrhythmic events. Careful monitoring and gradual rewarming are essential to minimize this risk.